Austin's COVID-19 hospitalization numbers are also going up. There were 100 new hospitalization admissions reported just today, but those numbers may not paint an entirely accurate picture. KXAN digital reporter Grace Reeder joining us live in the newsroom to help us understand why. Grace.
Well, Dr. Fauci recently said, don't look at case numbers right now, look at hospitalizations. But at least here in Austin-Travis County, if you go to the hospital with, say, a broken arm and test positive for COVID-19 while you're there, that counts as a COVID-19 hospitalization in our local data. Health leaders have said that wasn't skewing the data so much in previous surges, especially early as people avoided hospitals. But today, the local health authority said they're seeing an increase in that category of people. Dr. Walk suspects those are mostly people who are vaccinated, going in for unrelated issues, and don't realize they have COVID.
And Grace, what does that mean moving forward?
Well, it's important to note that Dr. Walks didn't give a breakdown of how many cases were people, or how many cases were people in the hospital for COVID versus people in the hospital who just happened to have COVID. What this means right now is that while we're seeing this huge spike in hospitalizations reported on the dashboard, the situation in our hospitals, while still not a pretty picture, might be slightly less severe than the numbers themselves show right now. And moving forward, the mayor said it like this today: in previous surges, COVID hospitalizations were a precursor to how full our ICUs would end up. But if you're in the hospital for a broken arm and you're having asymptomatic COVID, you're obviously not going to the ICU.
Right, but this is still a situation where health leaders are raising a red flag. What else can we look at to determine how serious this is?
Well, I think we can look at hospitalizations across the country and be sure that even though our data might be skewed a little high, people are still undoubtedly being hospitalized with COVID right now at elevated rates. Unfortunately, the true test will come in the next few weeks as we see how many people go from the hospital to an ICU and how many people ultimately die, Robert.
Grace Reeder live in our newsroom. Thanks so much.